Movement Disorder Center at Hartford HealthCare performed its 100th deep brain stimulator implantation since the program started in 2017. Here today to talk about this accomplishment is Dr. Benjamin Dorfman, a neurologist and movement disorder specialist at Hartford HealthCare. Doctor, thanks for being with us.
Thank you for having me.
Great. So talk about deep brain stimulation. What is it and how is it done?
Deep brain stimulation is a surgical intervention that can be done for patients with a variety of different movement disorders. At our center, we work with our neurosurgeon, Dr. Patrick Senidis, and the procedure involves implanting a wire into the brain that can be used to deliver electrical signals that can help patients better control their symptoms. It's been compared to a pacemaker, but for the brain.
Interesting. All right, who qualifies for deep brain stimulation?
It's only approved for certain neurologic conditions like Parkinson's disease, essential tremor, or dystonia. These should be patients who've tried and failed more conservative treatments like oral medications or botulinum toxin treatments and are still experiencing symptoms that are interfering with their quality of life. In the case of Parkinson's disease, it tends to work better for people who used to have a good response to medication and then later start to have more trouble with it. Unfortunately, it's not recommended for patients with moderate to severe memory loss or other severe cognitive symptoms.
All right, talk about some of the benefits of deep brain stimulation.
So deep brain stimulation can provide some of the same effects as the medications, but it can do so more continuously, whereas the medications' effects can fluctuate from dose to dose. Some patients are even able to decrease the amount of medication that they take once the DBS is up and running. It's not an option for every patient, but for the right patient, DBS can be powerful and the results can be life-changing.
All right, tell us about the Chase Family Movement Disorder Center and what it offers patients.
The Chase Family Movement Disorder Center is a comprehensive center that helps care for patients with a variety of different movement disorders at all stages of their diseases. In addition to the physicians, there's also physical therapy, occupational therapy, speech therapy, as well as exercise classes and support groups to help care for the whole body.
Nice. And Doctor, quick last question. Give us an example of an improvement you've seen in a patient, something that after they had deep brain stimulation.
So depending on which indication it would be for, you can see some dramatic improvements for some cases of dystonia where you have these involuntary muscle contractions. None of the medications might make an effect, but some of the dystonia diseases can actually only respond significantly to the deep brain stimulation, or in the case of Parkinson's disease, sometimes even without an effect of medication on their tremor, DBS can be the option that can really affect the tremor.
All right, Hartford HealthCare, Dr. Benjamin Dorfman, thank you for joining us. Very interesting.
Thanks very much.
Thank you.